Good afternoon, everyone, and welcome to the fourth installment of Equity in Action, Conversations with CareerSTAT Champions. My name is Tom Strong. I'm the Director of Employer Activation at the National Fund for Workforce Solutions. This series is part of CareerSTAT, our national healthcare sector strategy, which is a key part of the work that we do to help employers learn from each other, and specifically learn about kind of our keystone program, which is the Frontline Healthcare Worker Champion Recognition Program. We relaunched this program last year, and we were really thrilled to recognize 8 great organizations that are committed to creating good jobs, building equitable workplaces, and making significant investments in the skills and the careers of frontline workers, who we define as being healthcare workers making less than $60,000 a year with an associate's degree or less. Equity in Action is our way of inviting you into this conversation. You're going to get a taste of the programs and practices that our champion organizations have in place. There will be further opportunities to dive deeper, and we encourage you to jot down your questions. This will be a short interview, but we definitely will have a Q&A period towards the end of it. Today, I am thrilled to be joined by Dr. Johaun Jackson, the Director of Nursing Education, Research, and Development at Loretto. Loretto is a health system in central New York that serves a diverse population with a great range of ages, income levels, and care needs. They've got 19 locations and a workforce of 2,500 people. And Loretto runs adult day programs. They run skilled nursing facilities, short-term rehabilitation facilities, and assisted living communities. Again, Dr. Jackson is their Director of Nursing Education, Research, and Development. Dr. Jackson, welcome, and congratulations to you and the whole Loretto organization.
Thank you for having me.
So let's start on the personal side, if you don't mind. We're really interested in career development and workforce development in all forms, and all the stories. So tell us a little bit about your own career journey and how you came to work at Loretto.
Absolutely. I am a native of Syracuse, New York. I'm a product of Syracuse City School District. My journey started in an LPN program that currently no longer exists. I started back in 1998. And in doing so, I was welcomed into St. Joseph's Hospital that encouraged me to go to school, to stay in school. During which time I achieved my associate's degree at St. Joseph's College of Nursing. I went forward to finish my bachelor's and master's degree both at Lemoyne College, and finally my doctorate in education at St. John Fisher. In terms of how I found myself at Loretto, my entire career has been encompassed by critical care and acute care. So I've only worked in the ICU, in the emergency room, in shock trauma. And what brought me to Loretto was my grandmother. My grandmother, Lucille Jackson, was the matriarch of our family. And Alzheimer's disease struck my grandmother like a sledgehammer with no warning. And she essentially declined over a very short period of time, during which time we admitted her into Loretto. And after 20 years of direct patient care in acute care centers, I was able to witness the care that was provided to my grandmother in the last year of her life at Loretto Health and Rehabilitation. And after having seen that care, I was encouraged to make myself a part of the organization.
That's a really powerful story. Thank you for sharing that, Dr. Jackson. And I can, having had Alzheimer's in my own family, I can relate. Loretto itself has this rich history, clearly like that history and their quality of care spoke to you as a patient before you became an employee there. Can you share a little bit about the organizational history as well?
Absolutely. Loretto is a nonprofit organization founded by the Franciscan nuns back in 1926. In fact, it was the first home of the aged in North America, serving some of the most vulnerable populations of individuals. In its inception, Loretto was being Loretto Rest and only had about maybe 100 residents. To this day, now almost 100 years later, we are engaging in comprehensive continuing health care with almost 19 programs and services, servicing over 10,000 people in Syracuse, New York per year. We have programs such as independent and assisting living facilities, skilled nursing facilities, short-term rehabilitation, memory care facilities, which my grandmother was a part of, the PACE CNY programs, and a host of community-based programs with all-inclusive care. We're the 6th largest employer in Central New York, employing over 2,400 people, and the 4th largest healthcare system in Central New York, Onondaga County and Cayuga counties. We're also considered the state's safety net provider, which means we don't deny care to patients or residents based on healthcare status or their ability to pay. We accept them all. In terms of our employee population, we have a very diverse workforce because we are right in the middle of an area code that is, I won't use the word plagued, but is definitely known for challenges in terms of socioeconomic backgrounds and access to healthcare. We have been embedded in this community almost 100 years now. Typically, our frontline workers, the individuals that we serve are men and women of color, mostly women who are serving as the head of their households. And again, right now we're embedded in one of the most impoverished zip codes in the country.
So given the context that you work in, given the patient base that Loretto has and the employee base that Loretto has, all of that, in my opinion, made y'all like already a pretty great fit for the Champions program. But what took y'all over the top for us is that you also have this really comprehensive set of skill building and career advancement opportunities that you kind of keep under a overarching program called EDGE, which stands for Engage, Develop, Grow, and Excel. Can you tell us a little bit more about EDGE and the impact that you are seeing it have for your workforce?
I most certainly can. When we discuss leadership dispositions in organizations, one of the primary elements of those dispositions is intentionality. Meaning, we're not just expecting that individuals coming to work in leadership roles come with all the leadership pieces included. What we do is we intentionally imbue individuals with the leadership skills that will help them not just in the organization, but also out in their personal lives. When we talk about EDGE, we're talking about engagement, development, growth, and excellence. We designed this program to teach the basic leadership skills, but also to teach the skills that would allow for managers to have a pathway or a trajectory into greater dispositions of leadership. Our current Leadership Academy focuses on all the necessary leadership critical skills and practices. And we are turning men and women into extraordinary leaders. Extraordinary leaders. It's a 6-month interactive program that also articulates with many of our frontline advancement programs, in which we work to specialize and develop skills and additional wages for individuals coming in on the front line of the organization. We graduated almost 100 employees from this program. And as far as the academy is concerned, about 50 from the Frontline career advancement programs. We have a track record of paid training programs that serve as pathways and serve as additional trajectories into healthcare. Many of our programs, we are accepting individuals right at the front line of healthcare and allowing them to engage the organization in such a way that the front line doesn't become the end of the line, but the beginning. As they move through, and we provide them with a degree of work-life in these programs, allowing them to matriculate to educational programs with the added support of the organization.
I love that perspective, that the front line does not become the end of the line. And that, like, when we were originally considering your application, like, that is something we definitely saw at Loretto, this intentionality about growing people at every level and really kind of providing like numerous paths for people to advance their career based on their talents and their vision of their own future. As you mentioned before, you've also worked very deeply on the clinical side in healthcare. And so I'm curious too, like, how do you see these substantial investments in Loretto's workforce programs supporting your organizational priorities around great patient care?
With programs that we've developed, at least during my tenure here for the last 4 years now, Loretto has embraced the concept of emotional intelligence and conflict resolution, and has integrated those concepts into many of the programs that we currently have and programs that we have coming. And the reason that I make the distinction and focus on emotional intelligence is because typically when we train frontline workers, we are training them in the cognitive and the psychomotor domain, meaning we're teaching them what they should know and we're teaching them how to perform a skill. With emotional intelligence, we attempt to affect the affective domain, how they feel, how they interact with others, because that domain is what builds the necessary paths to empathy. How to deal, how to interact, how to work with others. It's not just enough to extend a job offer to a new employee, but to teach them how to interface with individuals on said job. I'd have to tell you that one of the greatest moments that I've had in one of our programs here was I had a student who was very resistant to the ideal of emotional intelligence. The student basically told me, I didn't come to class to learn how to be nice to people. And we followed this line of thought through the entire program. And that's for an entire calendar year. Once we got to the end of the program, the very same student came to see me in tears to tell me, thank you. Thank you for instilling the idea and concepts of emotional intelligence into our class. And I says, well, I'm sure that it helped you to get through your nursing program. She says, oh no, it helped me to save my marriage. It helped me to keep my family together. And being able to keep that family together helped to support her in the workforce, helped her to maintain licensure, because she was able to take the lessons and take the idea of building that degree of social awareness and take it into her home. So in our training here at Loretto, yes, we are looking to develop the prepared worker, but we are more in tune with building better people.
That's fantastic. So I want to open it up to the audience now. If you're watching this on LinkedIn and you've got questions or comments, we've already gotten a couple comments come in. Please chime in now. Like, go ahead and type in the chat box. Like, share your questions. We'll have a few more minutes to go through a Q&A. As people prepare their questions, Dr. Jackson, I do want to kind of observe a theme I'm seeing, which is kind of the real kind of importance of relationships at Loretto, and like both in terms of kind of the patient care relationship model that you all have developed and how that has really echoed within your workforce training programs, that you've kind of built this relational approach in everything that you do.
It has. And, like I kind of alluded to before, there has been an embracing in terms of value when we discuss these leadership perspectives, when we discuss the elements of emotional intelligence, specifically with individuals that we're bringing into leadership positions. Because one of the things that we discuss in the EDGE program, and that we also discuss in other leadership trainings, is the things that make an individual effective within the organizations that they reside. If you were to look at a person's efficacy and put it on a scale of 0 to 100, about 10% of that efficacy comes from a person's past education. 20% of it may come from previous experiences. But 70% of what speaks to an individual's efficacy, which also speaks to their longevity within said organization, lies in the manner in which they interface with others. How do they deal with conflict, inner conflict, outer conflict? What is their degree of social awareness? And how do they impart that social awareness onto the organization in a way that encompasses healthcare?
That makes a lot of sense. So again, we're taking questions right now from the audience. Please enter into the LinkedIn comment if you have any questions for Dr. Johaun Jackson. He's the Director of Nursing Education, Research and Development at Loretto. I'll add to Dr. Jackson. This is something that I'm just personally curious about. We in the CareerSTAT program, our primary membership so far has really been kind of hospitals, acute care hospitals, larger health systems. But we're really interested in kind of making this kind of work more accessible to folks in the long-term care space specifically. And so I'm curious, with your own transition into long-term care, like, if you feel prepared to answer, like how you experience kind of the difference in workforce development within the long-term care space versus where you came from before.
Oh, yeah. Do we have a question here?
Oh, we do have a question though. So we've got one user is asking, can you give some specific examples of how employees have used or benefited from EDGE programs? Sounds like that emotional intelligence piece was one of them, but are there others you can share?
I think that I have an example or two. I do have 2 academic managers right now in my department who, at the time when I met them, were nursing on the floor and providing direct patient care. But when they decided, or when the decision was made to advance them into management positions, we decided to engage them in EDGE training. Because, yes, they would have learned leadership dispositions from me and upper management and leadership, but I feel that within the organization, we're busy doing the work as opposed to teaching the work. Giving the newer individuals an opportunity to engage and ask questions. Because one of the elements of the EDGE training is the development of critical thinking. And very frequently, even in corporate America, we use the term critical thinking very loosely, but we do not talk about the elements that contribute to said critical thinking. Critical thinking simply is not built from the answers that we give. It's built in the questions that we ask. So the EDGE program provided my two managers with that safe venue to ask those managerial questions, to be faced with those managerial conflicts without having to learn them in a haphazard manner by just becoming a manager.
So really integrating experiential learning alongside more didactic learning. We have another comment echoing what I said, which is that this front line does not become the end of the line, but the beginning. Yeah, really love that quote. Just a beautiful insight.
Indeed. You know, just to add to this line of conversation very quickly, I had a discussion with one of my managers yesterday, and we frequently, once a week, discuss leadership dispositions. And one of the things that my manager was struggling with was the following of policy by individuals outside of the department. She asked the question, well, Dr. Jackson, how do we ensure that individuals follow policy? And she was very distraught about this. And one of the lessons taught within the EDGE program is about creating expectations, understanding what expectations are, and clearly expressing those expectations to individuals when you work alongside them. Because unanswered expectations really become premeditated resentments in the individuals for whom directly report to you. If as leaders, we're not expressing our expectations, following through on said expectations, providing guidance through said expectations, what we're really doing is setting the stage for premeditated resentments for individuals who are not following said policy and or procedure. So just discussions like this within the leadership dispositions within the EDGE program are the things that we're looking to make the mainstay for our leaders, our new leaders.
That's really interesting. And it reminds me of something I learned in a leadership training program I attended many years ago, which is an insight from the Gallup organization. The Gallup, in their annual engagement poll, the Gallup organization found at that time that the number one reason that people leave their jobs or become disengaged at work, it's not because they're quitting over pay. It's not because they're quitting over their manager. It's actually because they're quitting because their organization has not done enough to define the scope of their responsibilities. They don't understand well enough what they are responsible for and what they're not. So I think what you're sharing there like really resonates with that finding from them. Got another question. In my organization, we are learning that wages for allied health workers aren't keeping up with living wages. Can you speak to any personal or general observations you have about how to counteract or alleviate these wage concerns for workers interested in getting into healthcare but concerned about wages?
Yes. So about 4 years ago, we launched our LPN apprenticeship program. It is the first in the nation and is the first to be accredited by the U.S. Department of Labor. In saying that, the development of the program was encompassed by the idea of work-life balance. So we invited our kitchen workers, we invited housekeeping, individuals who worked on the lowest rung of healthcare, some of our certified nursing assistants into this program. And what we did in conjunction with our union is we created a program that provided the student with a degree of work-life balance that allowed them to ascend into some of those higher elements or into those higher realms of healthcare. particularly that into a licensed practical nurse. So to put a cap on it, the students would go to class and then they would come here on campus for a few hours, and all of that time was paid for. Their regular wages are paid for and covered by the organization. So you have a person who is really working 2 days a week for an entire year and collecting full-time compensation. What we gathered from that at the end were nurses who were not just prepared for the rigors of nursing and the rigors of healthcare, but individuals that didn't experience that burnout that goes along with going to school full-time and managing a family full-time. Right now, we are in cohort number 5. We've successfully graduated 38 students with a 97% pass rate on the New York State licensing examination. Of the individuals that we've graduated through the program, more than 65% of them now 4 years after are still in the organization working.
What can I say? What a point to end on. Just such an impressive program. I can tell you that the fact that you all were the first in the nation to do this this LPN kind of LPN apprenticeship was like a big deal to us, and we think it's an incredible practice that many others will want to learn from. We are approaching the end of our half hour, so Dr. Jackson, I want to thank you so much for this conversation today. I learned a lot. It sounds
Absolutely.
like it. Really appreciate you coming in to have this conversation. We look forward to more in the future. A few closing notes as we end up the half hour. This conversation can continue. If you are a member of CareerSTAT, we have an app called Mobilize that you have access to. And if you have further questions about the CareerSTAT Champion Award, about the programs that Loretto has developed and shared about in this half hour, you can continue this conversation on Mobilize, and our staff and other CareerSTAT members will be there to engage with you. There will also be a future deep dive on this and related topics. As you know, we're having one of these interviews a month. So every 3 months, we are having a panel conversation only for CareerSTAT members, but CareerSTAT is free to join. So if you're on this call, please join CareerSTAT and we'll get you in there. We will share the link to join CareerSTAT in the chat here. The next installment in the series will be June 12th. Same time, 1:30 p.m. Eastern time, and that's going to be with Bay State Health in Springfield. And last but definitely not least, please save the date for our shift convening, which is going to be in Memphis, Tennessee, September 24th through 26th. The registration just launched, and you can sign up now. The early bird period actually ends May 31st, so there's just a little over 3 weeks to do that. I'm very excited to say that Loretto and Dr. Jackson will be one of our presenters during shift, speaking in much more depth about the same topic. And Dr. Jackson, I very much look forward to seeing you there.
Indeed.
Everyone else, thank you all so much for your time today. Thank you for being engaged with CareerSTAT, and we hope you enjoy the rest of your day.
Thank you.